I'm Jennifer Coddington. I am Medical Director for North Central Nursing Clinics, which are under the School of Nursing. I am Director of the Pediatric Nurse Practitioner Graduate Program here, and I am also Director of Practice and Outreach for the School of Nursing at Purdue University. RSV stands for respiratory syncytial virus, which is a common respiratory virus of the respiratory tract. It is also one of the most common causes of bronchiolitis in children. So what it does is it causes edema or inflammation in those small airways, which are called the bronchioles, in infants and children. And sometimes we see it in elderly people as well. So by causing that edema and that inflammation, it leads to wheezing, coughing, congestion, sometimes low-grade fever, all those things that we see with when we see that disease. I think that all of us are wondering what is causing that surge, but it obviously this year has been coming a lot earlier, and it's hitting kids a lot harder than it used to. So we're seeing more severe disease in those kiddos. Typically, we'll see RSV peak in the winter season, so we're looking more at the January or the February season for it to peak. It has been reported in Indiana. Now, this may not be nationwide, but in Indiana, we have seen a slowing of hospitalizations with kids the first few weeks of November. Whether that's going to continue or not, we really don't know. But the thought is that the virus is encountering vulnerable populations right now, so those kids that have not been exposed to the common pathogens that they would normally be exposed to. And the thought is that because of the pandemic and because the population was masked for that mask mandate and the fact that there was lockdown, we're thinking that that's why these kids are getting this earlier and we're seeing more severe disease with it. And most people who contract RSV are going to be contagious for 3 to 8 days after they get it. So obviously if they're developing symptoms of coughing, wheezing, low-grade fever, the biggest thing that they can do is to cover their mouth if they're coughing. And we suggest when you cover your mouth that you kind of do it in your upper arm or your sleeve, or you do it with a tissue to cover your mouth. Washing your hands is really important, and doing it often is really important. So, and doing it for at least 20 seconds at a time when you're doing it. Cleaning surfaces that are being used often is also important to do that.